Thousands of nurses and doctors at state-run hospitals in Zimbabwe went on strike last year, demanding better working conditions and improved salaries. Now the Zimbabwean government seeks to clamp down on such work stoppages by classifying the sector as an essential service.
The health service now is subject to restrictions when it comes to labor action, such as strike or withdrawal of labor. So it's an essential service. It's people can just go on strike at the expense of the vulnerable who would be dying in hospital. One of the key things that has been put in place is that when health workers go on strike, which they are entitled to, still, they should make sure that there is a service that covers emergencies.
The healthcare workers claim they were not consulted and intend to fight this new law.
Because it clamps down on the fundamental right, which I believe is for any worker to go on in the industrial action. And well, they say that we are essential services, and there's a debate about is it ethical for who suffers most? The patient, it's the patient, of course, but as much as it is every patient's right, or every human, or every Zimbabwean's right to get patient care, it's also our right to get remuneration agreed upon.
Most government-run healthcare facilities are currently understaffed, following an exodus of doctors and nurses who have left the country. In the last 2 years, over 4,000 healthcare workers left the country, according to Zimbabwe's health watchdog. Now fears that the new law will further worsen the situation.
What I see, in my own opinion, is most people are going to go into private practice because people are scared. And most people are going to move out of the country because of that law. That's what I foresee, in my own opinion. Because and it also brings down the morale. That's which is not already there at the moment. It's like it's clamping down on us. So the morale, the small morale we had, I believe most people are not going to take this as a very good way to go about it.
According to the law, anyone inciting or organizing collective job action in defiance of the new conditions can be tried for a criminal offense and, if found guilty, fined or jailed for 6 months. However, the government has defended the new law and maintains it's not meant to clamp down on dissent.
What the government has done is just harmonize our practice here in Zimbabwe with international practice. In the UK, a territory I'm very familiar with, including the healthcare part of it, the doctors cannot go on strike, all of them. The issue of essential emergency care is always, it's natural, it's part of them. Even if there's a crisis, doctors on strike will just come back and to say, now let's attend to that crisis.
Health Services Board has been dissolved and a new Healthcare Services Commission will be established. Some now foresee a protracted standoff between government and the healthcare workers. All of this unfolds as Zimbabwe gears up for the hotly contested elections this year. Khalihle Khumalo, SABC News, Johannesburg.